The word health is incredibly difficult to define. Many of us take a healthy state for granted. It isn't until we become ill that we realize just how important it is to be healthy. As such, being healthy is very personal in nature, and our definition of health is influenced by several factors. Those factors include income, or lack thereof, age, and in a broad sense, our environment. If we had unlimited financial resources, access to healthcare services would not be impeded. When we needed medical services, we could easily find providers. On the contrary, being poor significantly limits our ability to receive services. It may even limit our ability to afford the necessary nutrients needed to achieve health. Hunger is a growing issue in the United States. Later in the course, we will more fully examine how healthcare providers are losing money and may not be as willing to provide pro bono or free services as they may have in the past. Another factor that influences our definition of health is age. A 20-year-old Olympic athlete would certainly have a different definition of health than someone in their late 80s. Age brings various conditions that might not have been present in our youth. As we learn to live with or accommodate for these conditions, the impact it had on our health may wane. The last factor to discuss is that of environment. As children, we model our behavior after our parents. If we grew up in a household that placed a high value on exercise, proper nutrition, and good sleep patterns, we are more likely to continue these behaviors through adulthood. As an interesting side note concerning parents and health, a recent study found that children will model health behaviors, whether good or bad, more closely to their mother. If the mother does not take health seriously and engages in poor health choices, the children likely will as well. It does not matter how healthy the father is. However, if the mother is healthy and the father is unhealthy, children will model the mother and not the father. Since it is difficult to agree on a definition of health, the medical field relies on the definition provided by the World Health Organization. They define health as the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. In later lectures, we will explore this definition more fully. There are many benefits of a healthy population. Chief among them are employment, productivity, and education. In short, healthy people work, and they are more apt to have more positive attitudes towards work, which therefore increases their productivity. Being healthy has a positive effect in all aspects of life. Healthy people are also more likely to work longer periods of time, if needed or asked. As a result, there are more taxes collected, which can then be used to expand health services. On the flip side, sick people miss work. Chronically sick individuals may not be able to work. As such, they rely on the taxes of the healthy. Too many sick individuals would eradicate government funding. In terms of education, healthy people tend to invest in education, especially higher education. Higher education increases salaries, which increases taxes, and in return, increases government funding of programs and services. Conversely, education is a low priority when sick. Prolonged childhood illnesses or ailments, including malnutrition, lead to a delay or even a cessation of cognitive development. Also, when children are ill, it negatively impacts school attendance. Illness is the number one reason in the United States why students drop out of school. Public opinion influences health policy. We know this simply because many politicians who are elected want to stay in office. In order to avoid being defeated, politicians will, more often than not, support the views of the majority of their constituents. Are there exceptions to this? Of course. However, for the most part, politicians will indeed listen to public opinion. As it relates to health, in the early 1920s, most Americans believed that alcohol was too harmful for society. As a result, we witnessed the passing of prohibition. A more recent example are the smoking bans passed in all 50 states. As was mentioned in the previous slide, a healthy population pays more in taxes, which allows for the government to simply do more. As such, the government has a very vested interest in increasing the health of its citizens. To accomplish this, the government performs several functions. The first is that they can legislate health prerogatives. The second is to actually provide health insurance. And the third is to undertake health initiatives. Although there are a lot of related health laws, for purposes of this class, we will highlight four: EMTALA, HIPAA, HITECH, and ACA. EMTALA is the Emergency Medical Treatment and Active Labor Act. In short summary, passed in 1986, This legislation made it illegal for any provider who accepts government payments to refuse anyone emergency services. In essence, anyone who presents to the emergency room must be medically stabilized before they can be discharged. HIPAA, or the Health Insurance Portability and Accountability Act, was passed in 1996. This act accomplished two objectives: to make insurance portable and to protect the information of medical records. In summary, prior to this law, if someone had a job in Tennessee and moved to California for a new job, the new insurance company could refuse to cover this individual. As a result of this legislation, the new insurance company could not refuse to cover the employee. This component made it easier for individuals to transfer careers. The other objective, information protection, is perhaps more well known. HIPAA makes it illegal to discuss contents of a patient's chart with anyone other than whom the patient authorizes. Strict penalties have been enforced as a result of infractions. HITECH is the Health Information Technology for Economic and Clinical Health Act and was passed in 2009. HITECH allocated $22 billion to increase health information technology with the key premise of improving all sides of the Iron Triangle: cost, quality, and access. The ACA, or Affordable Care Act, is perhaps the most encompassing piece of legislation since Medicare and Medicaid in 1965. As such, we will cover this separately in another lecture. Another role of the government is to provide insurance to those who have the greatest access concerns. They are the elderly, the impoverished, and children. Medicare is designed mostly for those individuals over the age of 65. Medicaid is designed for those who fall below certain income guidelines. And lastly, CHIP, or the Children's Health Insurance Program, provides insurance to those children of families who may earn too much to qualify for Medicaid, yet do not have a viable option of insurance coverage. The final role of government that we will discuss is that of overarching population health initiatives. The Healthy People Initiative was originally launched in the year 2000. It was revised for 2010 and yet again for the year 2020. The program is too massive to delve into here, and as such, a link to the program has been provided. As we just discussed, healthy employees are more productive. In next week's readings, you will learn about the history of healthcare in the United States. However, a little history is needed here to discuss the role of the employer in healthcare. In the late 1800s, the factory was dominant in most areas of American life. Unfortunately, the employees were deemed to be easily replaceable. As such, if someone missed work for being sick, the factory found a new employee to replace them, usually in the same day. It didn't take long for employees to determine that if they wanted to remain employed, they would show up to work at all costs. Employees who were then ill with all sorts of contagious conditions showed up to work and inevitably shared their illness with the entire factory. Factory owners were also quick to realize that while you could replace one employee for not showing up, it was impossible to replace and train an entirely new workforce without losing vast sums of money. As a result, companies began to offer sick insurance. This allowed employees to not lose wages and to not fear losing their employment should they need to stay home as a result of being ill. This sick insurance ultimately led to greater benefits. You will learn about these in week 2. World War II witnessed vast amounts of men enrolling into the military. When the war was over and the men were coming home, many of them found it difficult to return to the same job they had before they left. The reason was that women had entered the workforce in unprecedented numbers. When the war was over, women were reluctant to resign their positions because they were experiencing a new level of financial freedom and independence. The U.S. government passed wage restrictions, which were designed to favor men over women with the hopes of convincing women to leave the workforce. Many companies actually found that the women were far better than the men at their jobs. Where many men felt that they had to work, many of the women wanted to work. It was a huge difference in attitude, and it impacted the bottom line. Companies were unable to increase wages, and in some cases, were forced to reduce the wages offered to women. As a result, many companies decided to pay for the insurance offered to their employees, as insurance coverage was not considered part of wages. This had the effect of increasing an employee's take-home pay and offset the wage control limits endorsed by the government. Unfortunately, as a result of the 2008 recession, many companies were faced with a dilemma: either lay off vast amounts of employees or discontinue or decrease insurance benefits. In 1960, 75% of Americans were covered by employer-based insurance. By the year 2009, the number had fallen to 61%. Although the Affordable Care Act penalizes companies for not offering insurance, employee-sponsored health plans are still decreasing rapidly, which begs the question, what will the future hold?